they can now stay on their parents' health care. That's very, very important. You're the messengers to do that. And, you know, we're very happy now to have a student with us who's going to talk about how this law impacts students. And it's Tim Brusklowski with the American Medical Students Association here at the University of Maryland. We have loved over the years, I've been working on this issue since 1999, and a critical part of our coalition has always been AMSA, the American Medical Students Association. They're great. How many AMSA members do we have in here? Anybody besides Tim? Great, we love you. And so I want to introduce Tim, who's going to talk to you about from a student's perspective. Where's Tim?
Hi, like Mr. DeMarco said, I'm Tim Brusklowski, co-president of the University of Maryland's chapter of the American Medical Students Association. And today I represent the lucky ones. I stand for those of us who are fortunate enough to have parents who have health insurance and who can afford to pay to keep us on those policies. The provisions of the Patient Protection and Affordable Care Act that will be taking effect today will allow myself and other lucky young adults to remain on these policies until the age of 26. It will remove the threat that has for too long hung over the heads of young people who have had to skate by without health coverage. Now, as a pre-medical student, I plan on going to school until I'm at least 26 years old. And, you know, for me that means another 6 years where I'm not only unemployed, but where I will have to pay tens of thousands of dollars every year in tuition and fees. And this doesn't leave a lot of room left for insurance or unexpected medical bills that, in normal circumstances, have the ability to bankrupt a family. And as I said, I'm one of the lucky ones. I've known students with epilepsy, I've known students with diabetes, I've known students with lupus. And these are chronic health issues that have to be taken care of with quality and consistent care. And this is care that no average college student or young adult can reasonably afford. Now, this reform will allow me to continue school all the way through medical school, knowing that if anything were to happen to me, at least the resulting medical bills would not bankrupt me and my family. This reform will help to staunch what has become the fastest growing group of uninsured Americans. And I hope and I trust that this trend ends today. I hope that we never again leave millions of Americans uninsured simply because they fall into the wrong demographic category. And we thank you, Surgeon General Benjamin, and we thank all the progressive policymakers who saw the injustice in leaving young people uninsured and then did something to fix it. Thanks.
We love Tim, and he's got a brother, John, who's helped us very much in Baltimore. So the Tim and John team is really, really great. So thank you very much. And you know, this is a national day. We are doing 2 events here in Maryland, in Towson, and here at College Park. But there are events going on around the country. And there's an organization called Young Invincibles, led by Aaron Smith, that is making sure that events like this are happening from one end of the country to the other to get the message out. And I'm thrilled that he's here with us today to talk about what's going on around the country. Aaron Smith, where's Aaron?